So let's move on. We can start now. You are all welcome once again. So let's look at the learning objectives. Can we see the learning objectives? As the screen change, can you see the learning objectives? So at the end of this study section, you should be able to describe a bandage. You should be able to describe different types of bandage and their uses. We are all nurses. We are not MPTS students. So we are all practicing nurses. So this shouldn't be a new topic to us. We've done it in School of Nursing. So you should be able to describe the practice for bandaging, describe different techniques in clinical practice for bandaging. Are we following? So let's move to the next slide. All right. So for those dropping matric number, please, that is a rule. Do not drop your matric number. Drop your name or matric number. Just listen. Or else I will mute everybody. I will mute we will not be able to drop our matric number at all. So just listen and don't disturb the class. Thank you. So let's look at the definition of terms. So what is the bandage? Bandage is a strip or a piece of material. It might be clothes, or it might be a elastic fabric. We use it to support the body parts. Are we together? So we use it to support the body parts. Maybe if a joint is sprained, we have a sprained joint. We use it to hold a dressing in place over wound. Or is that not what in the word? So those are the things we use it for. We use it to apply pressure to control bleeding. You can jot if you want, because there are some things I'm going to be saying and it's not in the slide. So in order to avoid the slide being too voluminous, so you can have your pen and paper and jot. So we use it to apply pressure to control dressing. You can use it to immobilize a body part. Please, those that are dropping their matric number are disturbing my class. You are disturbing my class. Or else I'm going to mute the whole call and you will not be able to talk or do anything. So we can use it to immobilize the body parts, like a fractured limb. We can use it to secure splints or medical devices. I hope you are together. Then that would be the process or technique of applying a bandage to a part of the body. So bandaging is just the process of using a bandage, and it involves the correct method of wrapping or securing the bandage to achieve a desired purpose. So that bandaging, it might be to support, or maybe you are using it to suppress, to compress, or maybe to protect or to immobilize. And at the same time, you are maintaining comfort and circulation. Just a moment, please. All right, so let's move to the next one, which is benefits of bandaging. So what are the benefits? So we use it to protect the wound. It has several benefits. So when you use a bandage covers and shield a wound or surgical site. It prevents it from any form of infection, death. You want to keep that site sterile and clean. And it also helps to prevent further injury. Please, are we still together? Are we still together? Yeah. Okay. So we use it to protect. All right. So we use it to support a body part. We use it to protect wound or surgical site from death or any form of injury. So it helps to reduce risk of infection and also promote healing. Then number 2, we can use it to hold dressings in place. I think I've explained that. It keeps your dressings to be sterile. Are we together? So you can place it over a keep that wound sterile. And we can also use it to prevent displacements caused by any form of friction or any form of movement. Then number 3, we can use it to provide support. like a form of mechanical support to the weak parts of the body or injured body parts. If someone sustained a sprain now, or someone has a strain, or someone has a fracture, you can use bandage to hold that part together. Another important, another benefit is controlling of bleeding in most cases. So we can use to maintain hemostasis. A pressure bandage can help to compress blood vessels and maybe control hemorrhage, maybe minor wounds, in injuries, until someone is able to get treatment. We can use it to reduce swelling and inflammation. So when we apply bandage correctly, maybe it's elastic or compression bandage now, it can help to relieve any form of edema in conditions like venous insufficiency, maybe after surgery or sprain. I hope you are following me. Then we can also use it. It can assist in immobilization. So you can use it along with splints or slings to immobilize a limb or a joint to reduce pain and also promote healing. You can also use it to promote circulation when used correctly. So gentle compression can help to enhance venous return and also prevent pooling of blood. So that is how we can use it to promote circulation, especially in the lower limbs. For instance, if someone has varicose vein, I hope you are following me, and maybe someone has deep venous thrombosis. So we can use it to promote circulation in such situation. Are we together, please? We can use it to provide comfort to an individual. We can use it to secure medical devices. We can use it to hold splints, catheter, IV lines, dressing. So you can see that it has several benefits. So you can add your own. Let's move on. So what's the next thing we are seeing? Has the screen changed? I want to be sure we are on the screen. Has it changed? Has the screen changed to principles of bandaging? Okay, good. So let's talk about the principles of bandaging here. What are the principles you need to know? So when bandaging, you need to ensure that your hands are clean. Materials must be clean before application. Then you can place the body parts in a comfortable and functional position. So you don't just apply bandage anyhow. There are principles to it. You have to apply firm but not tight pressure to avoid impairing circulation. You know that when you are bandaging a body part and it becomes too tight, it can cause something known as compartment syndrome. Have you heard of compartment syndrome before? Do we know what compartment syndrome is? Compartment syndrome, have you heard of it before? We are nurses, so we should have heard of compartment syndrome. So compartment syndrome, it has 7 P's. P, there are 7 P's in compartment syndrome. There will be pain. Which other thing can we type? Pain is one. We have 7 P's of compartment syndrome. Can we type it? Pain. I've mentioned one. Pain. Pressure on palpation. Pallor, thank you. Which other one? Pulselessness. Is another one. Pulselessness is also a P. Paralysis. Poikilothermic. When that part of the body becomes cold. The part should not be cold. When you apply a bandage on the body part, you should be able to feel a pulse, distal pulse. It is to that place, peripheral pulse, that is distal. When you apply a bandage and you can't feel a pulse, you can't feel the peripheral pulse, the nearest pulse to that part, that shows something is wrong. So your patient is prone to having compartment syndrome. So you have to cover dressings completely and secure ends neatly. Then when you want to start your bandage, you start bandage from the distal part of the body, distal far end towards the body in order to support blood flow, not against blood flow. So some people doesn't know how to bandage. So it shouldn't be against the blood flow. It should be to support, it should be towards support the blood flow. I don't know if I'm making any sense. Then you have to check circulation regularly. So when we bandage a body part, you don't just forget about it, leave it in place and then forget. You should continue to check for circulation. You should check that area regularly to look for signs. So you check circulation regularly after bandaging. Look for signs like swelling, numbness, or bluish color beyond the bandage. So let's talk about classifications of bandage. Classifications. So we have different types of classification. We have different types of bandage. But in order to make it easy for us, I don't know if you are making sense. In order to make that classification easy for us, I decided to put it under two headings so that we will not be confused. So I decided to put it under two headings. So now, let's look at this classification based on material. So this one is based on material or form. So when we are saying classification based on material, that means what does the bandage looks like? That is just the meaning. What does it look like? So let's talk about the classification. Number one is roller bandage. Roller. When you hear the word roller bandage means long strip of gauze. So when you hear roller bandage, example is crepe bandage, conforming bandage, open weave bandage. So don't worry, I'll show you the picture. So that's an example of roller bandage. So we use it to wrap the arms, legs, or joints. We also have triangular bandage. We have triangular bandage. So that triangular bandage is a kind of big triangle from the word. So that is big triangular shaped clothes. We can use it as arm sling or head cover. We also have the tubular bandage. So when you hear tubular bandage, that is an elastic tube shaped bandage. So it can be used for the fingers, for the toes, or for the limbs. Number 4, we have adhesive bandage. That adhesive bandage has a sticky surface like a plaster. So we can use those ones for small cuts or maybe to hold small dressing. Then we have special bandage. Examples are the eye bandage. So let me show you the picture. Yes, it has a name, crepe bandage, roller bandage. Thank you. So that's what I want you to see. That's an example of a roller band. We are used to it. So we use this. In fact, this is the most common, right? If I'm right, this is the most common bandage that we use. As nurses, we use this is an example of a roller bandage. This is an example of a roller bandage. Okay. I've changed the screen. Can you see another one? What can you see now? This is an example. Yeah, conforming bandage. So that's another type of a roller bandage. That is another type of a roller bandage. So the one I showed you was crepe bandage. So that crepe bandage is an elastic bandage. It is made from cotton, maybe from elastic fiber, and you notice that it is stretchable, right? Crepe bandage. You know that when you are using it to roll the body part, you will notice that it is stretched, it is elastic. Have you noticed that? It is elastic, it's stretchy. You can use it to support, you can use it as a compression bandage. But this is known as conforming bandage. This one that you are seeing is known as conforming bandage. So it's made from soft woven material. So the reason why they call it conforming is not gauze. The reason why they call it conforming bandage is because it can mold. It can easily fit to any contours. It can easily fit to any body part. Okay. So look at this conforming bandage. Conforming. So that means when we say conforming bandage, it's usually very lightweight. It's a lightweight roller bandage. And it's made for soft material. So if you use this kind of bandage on the body part, it's easily into body contours. That's why we call it conforming bandage. So we can use it to hold dressing on irregular body parts. Irregular body parts. What are the irregular body parts? Can you give me an example? Example of irregular parts of the body. Irregular body parts. Can you give me an example of irregular body parts? I'm waiting for us. Can you give me example of irregular body parts? Irregular. When you say a part of the body is irregular, nurses. So this is adult class. It should be interactive. What do we mean by irregular part of the body? Irregular body parts. Irregular are the hands. Are your hands regular? Thank you. The knee, the elbow. Those are irregular body parts. So we can use a conforming bandage. So it's a type of roller bandage. Take a look at another one. So what are you seeing now? Let's give it time. Thank you. So what are we seeing on the screen now? Open weave bandage. Thank you. Open weave bandage. Open weave bandage. That's what it looks like. So this open weave. The reason why they call it open weave is because, how will I describe it? Open weave bandage is also a cotton roller bandage. So we call it open weave because it's very porous and it allows the air circulation when you use it. So it's a form of retention to all dressing where light support is enough. Is that okay? So it is porous, it allows air circulation. That's why they call it open weave bandage. Are we together? I've changed the slide. What are you seeing now? I've changed my slides. What can you see? What can you see now? What can we see? Triangular bandage. Thank you. So we have another type, triangular. I've explained it previously, so I'm just showing us the picture so that we can comprehend what I am saying. So this triangular bandage is a big triangle shaped cloth. Okay? So we can use it as arm sling. So you can see that they are using it to support a man. And use it as arm sling or head cover. That's an example of triangular bandage. Change the picture. This is an example of elastic tubular. Can we see this one? No, it's been enough of typing. Thank you. Elastic tubular bandage. Can you see elastic tube shaped bandage? So this elastic tubular bandage is used for fingers. We can use it for toes. We can use it for limbs. So elastic tubular. So it's very elastic. Very, very elastic. Very elastic. So they use it to support the elbow. Now let's move to the. So on the next slide, we have the adhesive bandage. I hope you have seen this a lot. This is very common, right? So which type of wound do we use this bandage for? What do we use it for? Look at how small it is. It's very small, right? This is a very common one that we use. Also, what type of injury do you use this for? Minor wounds. Thank you. God bless you. Minor, small cuts. It's usually in the first aid box. So if someone has a small cut, you clean that part, you apply small cotton wool or gauze, and you just. So it's not for a major injury. So we can't use it for a major injury. That's why we call it. Thank you for your response. Adhesive. So this adhesive has a sticky surface. So more like a small plaster. So we use it to hold small cuts. Then we have special bandages. So that is all about based on material or based on how the bandage looks like. So now let's move to classification based on medical purpose or function. Classification based on medical purpose or based on functions. So number one, what can we see? We have the retentive bandage. So that's based on the purpose or function. Retentive. So I will still be referring to the examples I've given us in the past, in the previous slides. So when we say retentive, that means these bandages are used to hold dressings. So retentive bandages are bandages that we use to hold dressings in place, maybe to hold splints or any form of device. So we don't really use them to apply any form of pressure. We are just using it to hold something in place. So we use it to secure dressing, maybe on wounds or surgical sites, or maybe to hold catheter, to hold splints, to hold. So we're just using it to retain, from the word retention. Are we together? So example, you can still see open wove bandage or conforming, and I've shown you the picture previously. Or maybe adhesive tapes or tubular retention bandages. I hope you are together. We have number two, supportive bandage. So these are designed to support or reinforce weak or injured body parts. So when we say supportive bandage, we use it to reinforce weak parts or injured parts of the body. It might be joints, it might be muscles. So this kind of bandage, they limit movement, they help to relieve strain. So that's why we call it supportive bandage. An example of it is sling or crepe bandage that I've shown you in the previous slides. Are we following? So we call them supportive. Another example might be spica bandage. Maybe for hip or shoulder. It can be figure of 8 bandage. It might be triangular thing. So we have a that we use to support the body parts. In fact, most of this type of bandage usually used in orthopedic injury. In the sprain, maybe when someone has a sprain in the wrist or shoulder dislocation. Then number 3, we have compression bandage. Compression. So from the word, what does it do? That means we use this type of bandage to provide a pressure, not tight. So it's not going to be tight. We are using it to provide a firm, even pressure over an area to control bleeding. So when you hear compression bandage, you can see that I put example snake bite bandage. So we use it to maintain even pressure over an area in order to control bleeding or to reduce swelling. So we use it to control. You can use it to reduce edema on a body part. You can use it to control hemorrhage. You can use it to improve venous circulation, venous return, or lymphatic circulation. So that's why we call it compression bandages. So it applies pressure over a part of the body. So that means you can use it in management of varicose veins. You can use it in management of venous ulcers. You can use it in post-operative swelling control. You can use it as a first aid for bleeding wounds. Or if someone sustained a snake bite, that means that type of bandage can be used. Am I making? Then we have immobilizing bandage. Immobilizing. So that one is used to prevent movement of body parts. So when you are talking about immobilizing bandage, you want to use it to prevent movement of a body part. So if someone sustained fracture now, you can use immobilizing bandage. If someone has a dislocation, you can use immobilizing bandage. You can use it to keep the joints or maybe the bones together, to align them properly. Are we together? Or you can use it to prevent further tissue damage. Because when part of the body is injured and it begins to move, take for instance, in a patient that has fracture, if that part, we are not able to immobilize it, what will happen? There will be further injury to that part. That means it will worsen that fracture that person had. So we can use it to immobilize the fractured limbs or joint dislocation. Then we have protective bandage. Example is eye bandage or scalp bandage. So when you say protective, that means you want to protect wound or sensitive area from being contaminated. You want to protect it from friction or from any form of injury. So we use this kind of bandage to shield wounds from infection, maybe to protect fragile skin. Say for instance, if someone sustained burns or maybe graft sites, we want to use it to provide a barrier against a trauma. So that's what we use this type of protective bandage for. Are we together? If someone sustained, thank you, for sensitive areas. So if someone sustained eye injuries or maybe after cataract surgery, we can use protective bandage. Is that making any sense? Then corrective bandage. So this is used in orthopedics. So we use we use it to correct deformities or to maintain alignment after surgical operations. So more like you want to maintain posture or alignment in deformities. You can use it to apply traction or correction. So when we say corrective bandage, it's used majorly in orthopedic operations. Yeah. So example now, we can talk about strapping for scoliosis. Scoliosis, or if someone has a club foot, they will need to correct that club foot. So they can use that corrective bandage. So for instance, we can also talk about orthopedic braces. Putting on of braces is also a type of corrective bandage. Or in a child with congenital deformities. In a child with congenital deformities. Have you heard of all these congenital, maybe hip dysplasia, you can use it. You can use all these pediatric orthopedic bandages to correct that deformity. Or maybe after someone has had a fracture, and the person has healed, use it for rehabilitation. Is that making any sense? So let's go to the next slide. So all the things I've been saying, let me show you the picture. So are we seeing this picture of a compression bandage? Snake bite bandage. Can we see? That's just an example. So this is an example. You know, we might not have seen this before, but just for learning purpose, at least we will know it. Even before, at least we are learning something new. Yeah, we are learning something new. So let's move on. How many people can see this? I didn't pause the video. Maybe it's the network. I did not pause the video. Please kindly cross-check and everybody to see. Can you see? So, you know, most of these online apps, you need a very good network. So sorry about that. Okay, so don't worry, I'm recording the class. So even if you can't see, maybe while listening to the class, you will see it while listening to the recording. Now, this is another part, POP cast bandage. So that's an example of immobilizing. POP cast bandage. A lot of us have seen this, especially orthopedic nurses. So this will not be a problem. Can we see this POP bandage? Immobilizing. Yeah, this is very common. We use it for casts. So it's also a part, also a type of bandage. Yeah. You can see, right? Okay. For people to see. I don't know why the video is paused. I don't know. I'm just confused. I'm confused myself that the video is paused. So what are we seeing now? Yes, it has different sizes. Thank you. We have shoulder spiker for immobilizing. So I'm showing us different types. Oh, everything I've been explaining. So that is what I'm showing us. So that's so unfortunate. Sorry. There is an advice that you should exit the video and join back. Kindly exit the video and join back. Well, let me see. So kindly exit and join back. Kindly exit and join back. So give me a moment. Let me reshare and let's see. Let me reshare, please. So let me reshare. Thank you. So how far now? I've reshared the screen. Let me see our average screen now. Let's see. I've reshared the screen. Is it showing now? Okay, so everybody can see clearly, right? Okay. All right. So please just manage. If you can see it like this, just leave it that way. Just leave it that way. Perfect. All right. Okay. So this is an example of shoulder spiker for immobilizing. So what can we see now? What can we see now? I've changed the screen. Perfect. Orthopedic brace. Orthopedic brace. So these are corrective type of bandages. Corrective. So we use it to correct. So this individual has scoliosis now. So we are using it to correct it. All right. So we are done with classification. So common bandaging techniques. Briefly, I want us to round up latest by past 12. Common bandaging techniques. Common bandaging technique. A lot of nurses doesn't know bandage. So we have forgotten. So we learn it. We'll refresh our memory on that. So common techniques of bandaging. So look at the different types we have. We have the circular turn, spiral, reverse spiral, figure of 8, spiker, and recurrent. So those are the different types. Those are the different techniques. Some people are still saying they can't see. I think I've tried my best to. So I don't think it's from my hand anyway. I do not think so. I don't think it's from my hand. So we have common bandaging techniques. We have circular. Circular, we have spiral. So when talking about circular, we use it for anchoring or small cylindrical areas, like our wrist, maybe the head. So, you anchor with about 1 to 2 circular. From the word circle, that means you are going in a circular form. That's how we call it circular turn. I wish it's a practical class, so we would have just practicalized it. So it's a circular turn. So each circular turn lies directly on the previous one. So as we are going in circle, that means the next one will lie on the previous one. So you go in a circular turn until you are done. Look at this picture. This is a circular turn. Hello, nurses, are you there? This is an example of a circular turn. So you are just going in that circular turn, nothing. Circular turn. That's what a lot of us are used to. But I know that nurses are good when it comes to bandaging. They are better than other nurses. Their specialization. So circular turns. So this is an example of circular turn. So let's go to spiral. Look at spiral. Can you see spiral? We can use it for forearm. We can use it for the leg. So it's good for even. So this is an example of spiral. So you can see this is not circular. It's not. It's spiral. So you go in that spiral turn. So you bring the bandage up in spiral form, overlapping previous turn by 2/3. So there is a technique. This is a technique. So this is an example of spiral. We have another one. So can I change it now? We have another one that is reverse spiral. So look at it. Reverse spiral. You can also use it for the wrist. You can use it for the forearms. So we can use it. So that's an example of reverse spiral. Can everybody see that? So let's take a look at this. So you can see in turn A, B, C, D. So it is a reverse spiral technique. Yeah. So please read more about it. Read more. So what can you see now? Another technique. That's another technique. Figure of 8. Please, can you see that? So more like an oblique shape. So bring bandage obliquely across the front joint, or maybe wherever you are using it to. Then opposite, you go opposite again. So we call it figure of 8 because we are creating a pattern of. So that's how we call it figure of 8. So it's not like overlapping previous tones. So this one helps you to, it gives good support. And it doesn't allow any form of slippage. So it's a very good technique of bandaging. It's a very good technique of bandaging. Are we together? Please, are we together? This one is that's an example. Recurrent. This one can be used for head. You can use it for stump. It may be in below the knee, above the knee amputation. So if they do a knee amputation for someone, this is the type of technique we should use. Recurrent. We call it recurrent technique. So we can use it on the head, you can use it on the stump, you can even use it on the finger. So you fold it back and forth. You are folding it back and forth over the end of that part. So you're using it to form a layer, like a coverage. So we call it recurrent. We call it recurrent. So what are your nursing responsibilities? When bandaging, you have to ensure the area is clean and dry. You have to assess the affected limb for circulation. I've mentioned it today. Note for signs of compartment syndrome. Make sure you select the correct size and type. Size and type of bandage. You have to explain the purpose to the patient. During bandaging, you have to maintain comfort and correct body alignment. Avoid excessive tightness. You have to cover the dressings completely, but leave maybe fingers and toes exposed. Then you observe the patient for discomfort or distress. So when you are bandaging a body part, watch your patient's expression. Don't just, because it might be too tight. Watch your patient's expression. Your goal is not to make it tight or to make your patient uncomfortable. Your goal is to support that body part. So you have to observe your patient for discomfort or distress. After bandaging, what should you do? Check for circulation. You continue to check it. Thank you. Check for the color, the warmth, capillary refill. Check for distal pulses. Check for sensation. You should be able to feel a distal pulse that is next to the side that you are bandaging. If you cannot feel it, that is pulselessness. And that is a sign of compartment syndrome. That means there is no blood supply. You have tightened everything. So take note of that. You need to elevate the limb if it is necessary. Then you secure and tidy up the bandage. It must be properly secured. You don't just bandage and forget about it. You have to secure it. Then you document your procedure. What are your patient reactions? Now, let's look at common errors in bandaging. What are the common errors, mistakes that we made? Bandaging too tightly. You are bandaging a part of the body, you are making it too tight. And the patient is going on with another problem more than the one they came to the hospital with. When it is too loose or even, you are not going to accomplish your goal. When you use uneven pressure, the pressure you apply in the first layer is more than the second one. Maintain even pressure. You have to maintain even pressure. Whatever pressure you are starting with, you should be able to complete it with that pressure. Covering the fingers or toes completely. If you are not bandaging the fingers or toes, there's no reason why you should cover it. Then placing a knot or clips over bony prominences. It's not going to stay in place. Or wrinkled or twisted bandage. So those are the common errors. Or you are bandaging in a wrong direction. I told you earlier on that when you are bandaging, that's to support blood flow. You shouldn't bandage in a wrong direction. You start from the far distal end. Inadequate covering of the dressing. Maybe you are using a bandage, not properly covering that dressing. When you ignore your patient's feedback, your patient is telling you that, nurse, this thing is too tight. That's how it's supposed to be. No, that you are a quack. That's quackery. So you should not ignore your patient feedback. when you are bandaging. Listen to your patient feedback. When your patient says it's too tight, nurse, you have to release the pressure. It's their body, not your own. Failing to reassess after application. When you are done applying bandage, you reassess. You reassess that body part. You check the distal pulse around that area. Not that you just bandage and leave. If it is the wrist you are bandaging, check for the radial pulse. Check for the brachial artery. Check for pulsation in that area. Using the wrong size or type of bandage, you should make sure you use the correct size of bandage. A person that is on the big side now, you can't use a small size bandage for them. You have to use the correct size when you do not anchor the bandage properly. So those are the instances. So let's quickly go to steps of bandaging. So preparation, you assemble your necessary equipment, your bandage, you need your dressing materials, scissors, pins, gloves. Wash your hands and explain the procedure to the patient. Take your patient's consent. Expose only the area you want to bandage and provide privacy for your patient. Inspect the skin for wounds, infections, or swelling. Then, number 2, application. You have to support the affected parts. Are we together? Please, are we still in the call? Are we still in the call? Okay, so I have 278 participants here. Okay. All right. So you support the affected parts, anchor the bandage with a circular turn, depending on the turn you want to use. If it is figure of 8, maybe you want to use spiral, you want to use whichever one that is prescribed. You follow that pattern and you maintain even pressure, like I've said. And you overlap that turn neatly. Make sure it's neat. Not that one area will be bigger than the other. So bandaging is a skill. You need to learn it. Then you secure the bandage end with a pin. When you are done, you secure the end with a tape or pin and you tuck it in very neatly. You have to make sure the end is neat. After bandaging, check for circulation. You see, I've said this like 10 times in this class. Continue to check for circulation. Comfort. You have to reassess every shift. The morning nurse, the afternoon, the night nurse, they must reassess. Everybody must keep reassessing. You ask the patient about pain. Are they having any form of paresthesia? Are they having any form of numbness, tingling sensation? Are they not able to feel that part? That shows you have done the wrong thing. And then you elevate the limb if it is needed. In case of swelling or bleeding control, you can elevate. When you are done, you document your procedure. You note the type of bandage you have used. Which area have you used it for? Nurses, you must learn how to document properly. What is your patient response? You have to document it. So with this, we have come to the end of the class. Thank you for listening.